everyone, and welcome back to Nurse's Lecture Room YouTube channel. My name is Nursemercymary, popularly known as a nurse with the difference, and I make learning easy and accessible for students. Today we're going to be talking about unconsciousness. What is unconsciousness? What are the likely causes of unconsciousness? What are the diagnostic evaluation for unconsciousness? What is the nursing management of unconsciousness? What is the nursing diagnosis of unconsciousness? And also, what are the complications of unconsciousness? By the end of this class, you will be able to answer all those questions correctly, because this lecture is going to be simplified as simple as possible. But before we go into details, kindly click on the subscribe button. Turn on the notification button so you don't miss out. Let's go there. Right, welcome back. Today we're going to be talking about unconsciousness. You will agree with me that as a nurse or as a student nurse that I've encountered an unconscious patient in the ward. These patients, they are not aware of themselves. They are not aware of their environment. They don't know what is happening. They are not oriented to time. They are not oriented to person. Neither are they oriented to the people around them. So today our class is going to be on unconsciousness, and we're going to be discussing about the causes of unconsciousness. First of all, what is unconsciousness? Unconsciousness is a physiological state in which the patient is not responsive to sensory stimuli. The patient is not responsive to sensory stimuli. Unconsciousness is a physiological state in which the patient is not responsive to sensory stimuli. You touch this patient is not responsive. He's not aware of what is happening around him or her, and lacks awareness. Take note of this word. Lacks awareness of self and environment. Unconsciousness is a physiological state in which the patient is not responsive, is not responding to sensory stimuli, and lacks awareness of self and his environment. An unconscious patient is not aware of what is going on around him or her. He's just there. He's just, let's use the word dormant in quotes. He's not aware of what is happening to him. He's not aware of what is happening to his environment. He's not aware. He's not responsive to stimuli. So an unconscious patient needs extreme care, needs our total support as nurses and as caregiver. So then that takes us to the causes of unconsciousness. For this class, the causes of unconsciousness will be divided into two headings. The first is the intracranial causes. As the name implies, intracranial causes. It simply means causes from the brain itself, intracranial, inside the brain, causes that arise from where? The brain. An example of intracranial causes of unconsciousness are, the first is tumor. And we all know that tumor is an abnormal growth. So when you have tumor in the brain, you have abnormal growth on the brain, it's likely going to result to what? Unconsciousness. Then the other one we have is head injury. Head injury can be as a result of road traffic accident, that is RTA. It can be as a result of violence, domestic violence. It can be as a result of fall, domestic accidents too. So the other one we have here is the cerebrovascular accident. Cerebrovascular accident is popularly known as stroke. In cerebrovascular accident, there's shortage or there's cut of blood supply to a particular area in the brain, and that can result in what? Unconsciousness. Then the other one we have is drug abuse. Excessive intake of drugs not prescribed by the doctors that you are not aware of can actually lead to unconsciousness. Most people abuse sedatives, and abusing these sedatives or whatsoever drugs this individual is abusing can likely result in what? Unconsciousness. Then the second cause is now of unconsciousness, which we classify under extracranial causes. As the name implies, extracranial causes simply outside the brain. Things that cause unconsciousness outside the brain. Things that cause unconsciousness as a result of metabolic and toxic activities in the body. So, examples of extracranial causes of unconsciousness. The first one we have here is hypoglycemia. Hypoglycemia, popularly known as low sugar, low glucose level in the body. We all know that the brain requires enough glucose to function actively. When hypoglycemia occurs, there is decreased glucose in the body. It can result in unconsciousness. Then the other is diabetic ketoacidosis. Diabetic ketoacidosis is a complication arising from diabetes mellitus. Is a complication arising from what? Diabetic mellitus. What that we have is liver dysfunction, fluid and electrolyte imbalance, acidosis, hypotension, shock, and multi-organ disorders. These are extracranial causes that can result in what? Unconsciousness. We also have the psychogenic causes, but the psychogenic causes is rare compared to the intracranial causes and the extracranial causes. The psychogenic causes could be as a result of catatonia or severe depression. Then that takes us to the diagnostic evaluation for unconsciousness. When we say diagnostic evaluation, we simply means the various approach used to gather clinical information to make clinical diagnosis. Diagnostic evaluation are the various approach needed to gather clinical information to make what? Clinical diagnosis. And the examples we have on the board is CT scan or MRI, computed tomography or magnetic resonance imaging. Then the other one is EEG, also known as electroencephalography. Then we have the arterial blood gas level. Then we have abnormal reflexes using a Glasgow Coma scale. A video on Glasgow Coma scale was prepared and is part of our YouTube videos. You can search for that. Then that takes us to the nursing diagnosis associated with unconsciousness. The first one we have here is ineffective airway clearance related to upper airway obstruction evidenced by dyspnea. You will agree with me that unconscious patients, most times they are lying helpless and their tongue are obstructing the airway. The tongue is what? Obstructing the airway. Definitely there's going to be ineffective airway clearance related to what? Upper airway obstruction by the tongue, evidenced by dyspnea. Ineffective airway clearance can also be related to secretion, excessive secretion coming out. Then the second nursing diagnosis we have here is imbalanced nutrition, less than body requirements, related to inability to swallow, inability to take in food, dysphagia, evidenced by pale conjunctiva or weight loss. Then the other nursing diagnosis we have here is risks for injury related to unconsciousness, related to inability of this patient to respond to stimuli, or this patient unable to. This patient is not aware of his environment, so there's going to be risk for injury because the patient does not know where he's going, where he's coming. He's not even aware of what is going on around him or her. Then that takes us to the management of an unconscious patient. When we talk about the management, the goal of management is to preserve the brain function. You have to protect the brain function so that it doesn't go into brain damage. So the goal of unconscious, or the goal of management, is to preserve the brain function and prevent further damage. That's what you are doing. That's the goal of management. The medical management is based on the cause. You don't just treat like that. You have to find out what causes this unconsciousness. From finding out that details, you will be able to know how to manage this unconscious patient properly. So the medical management for unconsciousness is based on what? On the cause of the unconsciousness. Then the other one we have here is, in terms of your nursing responsibility now, how to manage this patient properly. The first we have here is to monitor change of CNS, neurological status. You have to monitor this patient's neurological status regularly using Glasgow Coma scale to know, oh, is this patient level of consciousness coming down? Is this patient level of consciousness going up? Is my patient recovering, or is my patient going into coma? So you have to monitor the neurological status of the patient. Then the other is airway/breathing. You have to emphasize on clearing the airway. You have to emphasize on ensuring breathing of this patient, because this patient is not aware of himself, because this patient is not aware of his environment. So you have to what? Ensure that the airway is cleared and ensure that this patient is breathing properly. If possible, give prescribed oxygen depending on the severity of the case. You place patients on oxygen. You position the patient in a Fowler or semi-Fowler's position. You turn the head to one side to enable secretion drain out. So these are also some key points you have to note when managing an unconscious patient. Then the other is oral care and personal hygiene. Remember, this patient is unconscious. Remember, this patient is not aware of what is going on in his environment. So his oral care, mouth cleaning, his oral care depends on you as a nurse. His personal hygiene, bed baths also come into play for an unconscious patient. Then exercise and pressure area. Remember, there are two types of exercise. We have the active exercise and the passive exercise. And the passive exercise, it is what you, the nurse, help the patient accomplish. So you have to carry out passive exercise now for the patient. Then you have to treat pressure areas. Areas that are prone to pressure sores, you have to treat it. This is one of the responsibilities of the nursing management when it comes to what? Unconsciousness. Then the other is hydration and nutrition. This patient does not know what is happening. He's not aware of what is happening. So his nutrition and his fluid depends on you as a nurse. So you have to ensure that this patient take the recommended IV infusion. You have to ensure that this patient is well hydrated. Then the other is protect patients from injury. For an unconscious patient, you have to put sideways. You have to ensure that this patient does not fall from the bed or something. So it's your duty to what? Protect the patient from injury. Then the other is catheterization. Catheterization. This patient cannot move. This patient is not aware of, it's time for me to urinate, it's time for me to do this. No. So that is why you have to put the patient, you have to catheterize the patient, so that urine can easily flow from the bladder into the urinary bag. Then if possible, you put this patient on pampers. You put pampers for fecal matter that are likely going to pop up or come out from the anus. Then that takes us to the complication of unconsciousness. One of the complications or the complications of unconsciousness that I have here on the board is we have brain damage, we have fracture, we have impaired memory, we have infection, and we have coma. These are the likely complications that are going to arise from unconsciousness. Thank you very much for staying tuned. I hope you got value for this video. Kindly drop your questions on the comment section. If you have anything to share, drop it on the comment section. Don't forget